What if I told you that a single tiny change in your DNA could turn your body's life-giving river of blood into a constant painful traffic jam? Well, that's the reality for millions of people living with sickle cell disease. Today, we're going to break down exactly what this disease is, how doctors figure it out, and the incredible strength it takes to manage it every single day. All right, let's get into it. This question, it really gets to the heart of the matter, doesn't it? The very system that's supposed to deliver oxygen and keep you alive can suddenly become the source of a dangerous, agonizing blockage. This is the fundamental problem of sickle cell disease, and we're about to see exactly why it happens. And here it is, the root of the problem side by side. On one hand, you've got a normal red blood cell. See how it's perfectly round, smooth, and flexible? It's literally built to just glide through even the tiniest blood vessels. But then you look at the other side. That's the sickle cell. It's stiff, it's sticky, and it's bent into that crescent shape, kind of like a sickle. And that one little change in shape, well, that's what causes all the trouble. So, you're probably wondering, how can one microscopic change in a cell's shape cause such big problems? Well, think of it like a domino effect. That one messed up cell starts a chain reaction that can ripple through the entire body. Let's take a look at how that plays out. Okay, so because these sickle cells are so fragile, they break down way faster than healthy cells. This leads to a constant shortage, a state of anemia, which is why patients often look pale. That's the pallor. And when those cells break apart, they release stuff that can make the skin and eyes turn yellow, which is a condition we call jaundice. On top of that, the lack of a steady oxygen supply can even slow down a child's growth. It's a really powerful example of how one small issue can have huge body-wide effects. With consequences this serious, you can bet that getting an early and accurate diagnosis is absolutely critical. And the good news is, in a lot of places, testing for sickle cell happens right after a baby is born, so care can start immediately. In many parts of the world, it's now standard for newborns to get screened for all sorts of conditions, using just a tiny drop of blood from their heel. This screening looks for disorders that affect hemoglobin. That's the protein in red blood cells that carries oxygen. Sickle cell is one of these, what they call hemoglobinopathies, and catching it this early is, frankly, a total lifesaver. Okay, now this chart is where it gets really clear. This shows the results of a test that separates out the different kinds of hemoglobin in the blood. Look at HbS, the sickle hemoglobin. It's making up a whopping 90% of the total. And then you look for HbA, which is normal adult hemoglobin, and it's at 0, none. This test result is the smoking gun. It confirms the diagnosis, no question about it. But, a diagnosis is really just the beginning of the journey. The day-to-day challenge of living with sickle cell comes in the form of what's called a crisis, a sudden, incredibly painful event that can even be life-threatening. The most common one is the vaso-occlusive crisis. Remember our traffic jam metaphor? Well, this is the real deal. It's like a massive pileup on the highway. Those rigid sickle cells get stuck, they block the blood flow, and they starve tissues of oxygen. And the things that can trigger it are just everyday things. Getting a little too cold, catching a bug, or even just not drinking enough water. That's all it can take to kick off an episode of unbelievable pain. So when a crisis hits, the medical team has to launch a full-on attack. First, they warm the patient up to help the blood vessels relax. They push a lot of fluids through hydration to try and break up that logjam. They give oxygen to make up for the blocked blood flow. Pain relief, and I mean strong pain relief, is absolutely essential. And because infections are such a common trigger, they'll often give antibiotics just to be safe. And that vaso-occlusive crisis, it's not the only danger. The sickle cells can also get trapped in the spleen, making it swell up dangerously. They can clog the blood vessels in the lungs, which causes a life-threatening condition called Acute Chest Syndrome. And if that blockage happens in the brain, it can cause a stroke. This disease can really attack any part of the body at any time. So, how in the world do you fight a disease that can strike at any moment? The only way is with a lifelong, proactive plan for prevention and management. It's all about trying to stay one step ahead of the next crisis. A major part of that preventative treatment is a drug called hydroxyurea. For many patients, this medication is a real game changer. Basically, what it does is it encourages the body to make more of a special kind of hemoglobin that we all have as babies. This fetal hemoglobin doesn't sickle, so it helps keep the blood flowing more smoothly. For anyone dealing with frequent crises or other severe issues, this drug can make a huge difference in their quality of life. But like any powerful medicine, hydroxyurea isn't without its downsides. The most serious one is that it can slow down the bone marrow, which is the body's factory for making blood cells. This condition is called pancytopenia, and it means you have fewer red cells, white cells, and platelets. That can lead to fatigue, a higher risk of infection. You get the idea. And that's exactly why patients on this drug need to have their blood checked regularly, just to make sure everything is okay. Blood transfusions are another crucial tool in the toolbox, but it's important to know that not all transfusions are the same. A standard blood transfusion is pretty simple. It just adds healthy red blood cells into the system. But for the really severe, life-threatening events like a stroke or acute chest syndrome, doctors have to do something called an exchange transfusion. That's where they actually remove the patient's sickled blood while simultaneously replacing it with healthy donor blood. Managing a condition like sickle cell disease, it's just not something one person can do alone. It really does take a village, a whole dedicated team of specialists who work together with the patient for their entire life. The main doctor is usually a hematologist, an expert in blood disorders. But since these blockages can happen anywhere, you need a whole crew: a neurologist to watch for stroke risk, an ophthalmologist to protect the eyes, an orthopedic specialist for bone issues, a nephrologist for the kidneys. The list goes on. It's a powerful reminder of just how complex and far-reaching this disease really is. And beyond the doctors, the patient themselves has a massive role to play in staying healthy. Simple, everyday choices can make all the difference. Things like staying warm and drinking plenty of water can help prevent crises. Avoiding big crowds and getting every single vaccination helps fight off dangerous infections. These aren't just suggestions. For someone with sickle cell, they are life-saving habits. So after all this talk about managing the disease, you might be asking, is there a cure? And the answer is sort of a qualified yes. A bone marrow transplant, or what doctors call a Haematopoietic Stem Cell Transplant, can cure sickle cell. But it's a very risky, very complex procedure, and it's not the right choice for everyone. Still, as medicine gets better, this option is becoming safer and more available, which offers a lot of hope. And that really brings us to our final thought. With these incredible advances in things like gene therapy and our ever-deepening understanding of the disease, you have to wonder, how close are we, really, to a future where these painful, dangerous crises are just a thing of the past? It's a question that keeps researchers pushing forward and gives hope to millions. Thanks for joining me today.